Hi friends, and welcome back to my channel. I'm Nurse Lizzie. In today's video, we're going to be reviewing tonsillitis, a very common condition that we see among our pediatric patients. Before we go ahead and get started, be sure to click the subscribe button below so you never miss one of my uploads. Give this video a thumbs up, share with your friends and family, and as always, be sure to check out my website, nurselizzie.com, for additional educational content. Now, on to tonsillitis. So tonsillitis is very commonly seen among our pediatric patients. So what it is it's just this acute inflammation of the tonsils. Over time, it can actually become a chronic condition. So think way back to anatomy and physiology. What your tonsils do, they're actually part of the lymph system. They're lymph tissue, and they serve a role in our immunity, filtering out bacteria and other threats to the body. But like anything, they can become inflamed. So when we have kids that have this tonsillitis, what causes that and some of the risk factors that are present are pediatric patients obviously just have some immature immunity. We see tonsillitis, especially among school-age patients. They're out at school with their friends. Hand washing may not be so great, and they are exposed to viruses and bacteria. So the bacterial cause of tonsillitis that you should know and remember as you're studying for NCLEX would be group A, beta hemolytic strep. We'll talk about that in a moment. Our assessment findings, as well as some of the chief complaints they may have for us, of course, and when we look in the back of the throat, we may see reddened and inflamed tonsils. They could be edematous. There could definitely be some exudate there. They may have some poor mouth odor that you can appreciate on examination, complaints of sore throat, onset of fever, difficulty swallowing, decreased appetite. Their parents may report that they're a very noisy breather when they're sleeping, or they may say, they snore a lot when they're sleeping. They may also have a history of otitis media, that middle ear infection. And then, of course, we may be able to palpate some swollen lymph nodes in the neck and around the jaw as well on physical examination. So if you look over on the screen here at my drawing, again, it's just a quick little drawing, don't judge me, but you can see tonsillitis versus our normal findings. So our picture over here on the right-hand side, you can see how the tonsils are much larger. You have your uvula with your right and your left tonsil. You can see that they're swollen, they're inflamed. If we were looking back into the back of the throat here versus the normal appearance, we should be able to see tonsils, but they shouldn't be taking up all that space in the back of the throat. So to diagnose these kids, in addition to the physical assessment findings and the findings that their parents report to us as well, we want to diagnose this by swabbing them. So this is going to require a throat culture because what we're actually looking for is to see if they are strep positive. So if they are, we're testing for, again, that group A beta hemolytic strep. Treatment for these kids with tonsillitis. Number one is rest. So lots of rest, lots of fluids to prevent dehydration. Warm fluids are helpful, things like broth, like a warm cup of tea. With kids, if you're able to, a saltwater rinse or a saltwater gargle is really helpful to decrease pain and promote comfort. Antipyretics are helpful in reducing fever as well as some pain management, so things like acetaminophen. And then, of course, if they did in fact test positive for strep, we need to make sure that they're started on antibiotic therapy. Very important as a nurse to stress with your education to the parents and the patient. They need to finish that full course of antibiotics. They don't stop taking it just because they're feeling better. We don't want to see a rebound strep infection, so make sure that they're taking the entire course of antibiotics. If there's other kiddos in the household, parents should be monitoring them for findings of strep throat as well. Get this child that is positive for strep, they should have a new toothbrush just so they're not reinfecting themselves over time. Hand washing for everybody in the family again as well. So now what we have to be concerned about and what we're going to address is these kids with chronic tonsillitis may in fact be candidates for a tonsillectomy. So what is a tonsillectomy? It really is just the surgical removal of the tonsils. Again, a procedure we do for kids that are suffering from chronic tonsillitis. Now, if you happen to be lucky enough to get to observe in like a PACU setting, or you're looking at the H&P on your patient and you see they had a T and A, what that stands for is a tonsillectomy and adenoidectomy. So the adenoids, they're also part of the lymph system located in the nasal cavity. Often they become inflamed as well. So if we're going to go in and remove the tonsils, often surgeons will remove the adenoids at the same time, which stands for that T and A, or the tonsils and adenoidectomy. What's most important is to understand what we need to do preoperatively, postoperatively, and then reviewing our signs and symptoms of hemorrhage. So preoperatively, your patient is going to be getting general anesthesia. Really important as a nurse to make sure that they've had nothing by mouth for the allotted time per the physician. We should be checking allergies, making sure they have an IV site placed, and getting IV fluids started because as a child, we don't want them to become dehydrated. Post-operatively, once they're out of PACU and they're back to the floor and we're taking care of them, what is most important to remember is that risk of airway compromise, because we've just been in there surgically manipulating the airway by removing these tonsils. So there can be some adverse complications that we're looking at post-operatively. Number one, check for bleeding. I can't stress this enough. Chances are if there's a complication in the post-op period of a tonsillectomy, it's due to hemorrhage. Check for vital signs. Are there changes? Are there any indications of hypoxia? Check that airway. Visualize with a light source. So we're doing throat checks on these children very frequently when they are recovered in the PACU area and still when they come back to the floor. You should use a light source so you can truly see into the back of the throat. So whether you have a pen light or a flashlight, have them open up, say ah as best as they can, but you want to be able to visualize the back of that airway. An ice collar we can put on post-operatively. That's really helpful in aiding with comfort. Position them to promote drainage. So we want them to, once they're awake and alert enough, we want them to be sitting with the head of bed elevated to help promote drainage. Let gravity work for you, not against you. We can offer them clear liquids. So really important again that they're able to keep fluids down, tolerate fluids. So in this case with clear fluids, they should not have any kind of red dye, which we'll talk about in a second. And then of course, pain management. So chances are we're going to have something ordered for them PRN or as needed. And then they're probably going to get something around the clock as well, whether it be just acetaminophen or whatever it is that the provider wants to write for them to have as orders. What's most important to remember post-operatively as a nurse, we need to avoid straws. The reason for this, if you think about when you're sucking through a straw or you're using a straw, it's very easy for that straw to move or kind of scratch around like the roof of your mouth or the back of your throat. One wrong move could really cause some injury to the surgical site where they remove the tonsils, and we don't want to disrupt any sutures. It's for this same reason we want them to avoid any kind of nose blowing in the fresh post-operative period. As I mentioned, no red dye. So popsicles are great. Italian ice is great, especially for somebody who just had tonsillectomy, but we want to make sure we're not using those products that do have red dye, because if there would be any hemorrhage taking place post-operatively and a patient's also getting products with red dye, if they were to vomit up any fluids, it can be difficult to determine what is in fact blood and what is in fact the red dye. So we just avoid it altogether. And then lastly, avoid citrus and spice. So this is not the time for like a lemonade, would be really uncomfortable on the throat. Anything spicy. So we're going to avoid Mexican food right now. And I don't have it up here, but it's worth mentioning carbonated drinks. So anything with soda, we just want to try to avoid that because it can really be uncomfortable with that swallowing. And we want to make sure that post-operatively they can continue to take in fluids. What's most important and the biggest complication that we can see from a tonsillectomy would be hemorrhage. So what signs and symptoms do you need to know about as a nurse? Number one, frequent swallowing. That is one of the biggest indicators that a child is in fact bleeding into the back of their throat and they just keep swallowing to try to clear out the throat. Secondly, restlessness. So remember learning about, I'm sure with the respiratory system, a sign of hypoxia is first often shown as restlessness in a patient. So that can be indicating that there's a further complication taking place. Frequently clearing the throat, as I mentioned, it could be due to them swallowing blood. Tachycardia, as you're monitoring vital signs, if there is any kind of bleeding taking place, we could see an increase in that heart rate. Of course, pallor when we're looking at the patient. They should be warm and well perfused at this point in the postoperative period. If you see any of these signs or you have any questions, don't wait. Contact your provider immediately so they can come and assess the patient because we want to prevent any further complications from taking place. I hope you found this helpful in reviewing tonsillitis and our patients who are candidates for a tonsillectomy. As always, thanks so much for watching and be sure to check back on my website, nurselizzie.com. Bye.